how testing for antibodies can help Arizona flatten the curve.
It'll give you a sense as to how widespread the virus is.
The pandemic put some nonprofits in the red.
They're not going to be able to open in the summer, even though the state's going to open up.
And the crisis gives rise to new concerns in the classroom.
It's a lot of uncertainty. I think we need to brace ourselves for a new way of learning.
Hello and welcome to Arizona 360. I'm Lorraine Rivera. Thanks for joining us. President Trump's visit to Arizona this week thrust it into the national spotlight. It was his second stop in Phoenix this year. This time he toured Honeywell's new assembly lines for N95 masks and touted manufacturing as key to reviving the country's economy. The president's trip also coincided with an announcement from Governor Ducey to reopen more of the state's shuttered businesses.
In addition to retailers, salons and barbers can open their doors starting on the 8th, and by Monday, restaurants can offer dine-in services.
Get your hair cut, get something to eat, and head home.
The governor says certain metrics related to COVID-19 are headed in the right direction.
We have a downward trajectory of influenza and COVID-like illnesses. We have a downward trajectory of positive tests. That means a downward trajectory of the percentage of people that are contracted COVID-19.
Meanwhile, the state's so-called testing blitz is ongoing and involves testing up to 60,000 people over 3 weekends. So far, more than 9,000 Arizonans have tested positive, including Paula Summers, who started showing symptoms in March after returning from her son's school trip to New York.
First of all, I thought, of course it would be me. 1 out of 100 people, I would be the one. But I was thankful that I am because I am healthy. I've run marathons and triathlons. I knew I would be okay.
Doctors tested the 47-year-old Tucsonan for COVID-19 after a flu test came back negative and X-ray showed she had pneumonia.
This was, I would say, 100 times worse than the flu.
She spent the next few weeks quarantined at home.
I was lucky. I did have people taking care of me. I couldn't imagine doing this on my own. I don't think I could have made it.
Now Summers hopes she can help others by participating in the Red Cross's convalescent plasma program. Led by the Food and Drug Administration, this experimental program collects and processes plasma donated by recovered COVID-19 patients that can then be used to treat people critically ill from the disease.
If we can find a cure, the sooner the vaccination or anything that we can help out with, maybe the sooner our country can get back to normal, whatever normal will be.
In addition to her plasma donations, Summers also took part in the University of Arizona's Antibody testing initiative, which aims to eventually test everyone on campus, along with 250,000 healthcare workers and first responders statewide, to determine how many may have developed antibodies against the novel coronavirus.
How's your day going so far? So far, so good.
Among those already tested, U of A President Bobby Robbins, who announced plans to reopen campus this fall.
Test, trace, and treat. 3T approach to providing our campus a flexible and adaptive teaching and learning environment.
As antibody testing ramps up, we learn more about how the results can aid the state's response to the pandemic from university researcher and immunologist Deepta Bhattacharya.
One of the most important things is it'll give you a sense as to how widespread the virus is within our state and within local communities. As we know, it's very different between somewhere like New York City and somewhere like Arizona, in which the wave is substantially later. So I think that's the most important and tangible piece of evidence that we'll get. We'll also start to get quite a lot of evidence in our questions on how long does immunity last? How long do you produce antibodies for after you've been exposed to the virus? And then, unfortunately, once the second wave hits, I think we'll get a little bit of a better sense as to how many antibodies do you actually need to protect you from getting reinfected. And so these are all really important questions, and we have to get a baseline level of seropositivity rates and antibody levels.
Let's say people do the test for the antibody. I'm not asking so what, but then what? Does that mean I can go into a grocery store and I don't have to wear the mask or the gloves?
Yeah, I mean, it's a good question. And there are a couple of different ways you can approach that question. You can approach it from the standpoint where we assume nothing about this virus, and we need to learn everything. I'm really more in the camp that we should learn and start as our baseline all the things that we've learned from viral immunology over the past 50 years, which is that if you've been exposed to something, an acute viral infection, and you've cleared it, you're almost certainly at reduced risk of getting infected again. So almost certainly you would get less sick than if you had never seen it at all. Now, there's a lot of nuance to that, though. I mean, how many antibodies do you have to truly be fully protected? And those are unfortunately not the answers that we have, and we probably won't know until that second wave hits.
What about this concern over false positives?
Yeah, that's a huge concern. And, I think one of the things that we've been learning as we develop this test in Arizona, because the wave has hit here a little bit later than some of the others, is really looking at some of the data that's been coming out of other tests. And certainly we've seen a lot of concern with the inaccuracy of some of these tests, particularly the finger prick tests. And so the FDA, as some of the viewers may know, issued some new guidelines over the past week to make sure that the tests are actually working as they should. Ours is not a finger prick test. It basically requires a blood draw and sending those samples back to the central labs here at University of Arizona. So the big difference is that our test produces a number, and that allows us to set very strict statistical thresholds to make sure that we're not getting very many false positives. That does come at the expense of false negatives, and we decided that that was the lesser of two evils, so that if you have some low levels of antibodies, there's a reasonable chance that our test will call you negative.
As people continue to hear about the testing options available to them here in the state of Arizona, what do you say to them who maybe remain on the fence about should I bother doing this?
I mean, I think it's up to every individual in every particular circumstance to decide why they should or they should not. I mean, unequivocally, if you have symptoms, you should check in with your healthcare professional and decide whether or not the viral test is appropriate to see if the virus is actually actively in there. I think that's a no-brainer, and I think that's a really important part of trying to keep the virus under control. The antibody test, I think a lot of it has to do with whether or not you're at a high risk and whether you've had symptoms consistent with COVID-19 but weren't first tested, and what the implications of that positive test may or may not be for you and in your profession.
Dr. Deepta Bhattacharya, thank you for your time.
Thank you, Lorraine.
Hospitals in Arizona welcomed the return of elective surgeries this month. Services had been paused to make room for a possible influx of COVID-19 patients. That led to financial setbacks for some facilities, including Tucson Medical Center, which estimates it has lost more than $16 million these last 2 months. We learn more from Chief Operating Officer Mimi Kumler. Tucson Medical Center has about 4,500 employees. Have you had to reduce staff or place any on a temporary leave as a result of COVID-19?
Yes, who would have thought that the results of a pandemic would result in laying off or furloughing of healthcare workers? But based on some of the changes that happened in terms of our nation and our state's response with reducing elective surgeries, reducing elective diagnostic tests, the numbers of patients that walk our halls or seek treatment at TMC have been reduced dramatically. In surgery, we have reduced our surgical volume by 60%. Diagnostic mammography, we put on hold entirely. And so many of our healthcare workers, we've tried to preserve their benefits and their positions, but we've reduced their hours, in some cases up to 60%, and in most cases, at a minimally 30%.
When the governor announced that elective surgeries and other treatments or tests could resume, I can imagine that you can't just flip a switch and start work back to normal. So how did TMC prepare for that announcement?
We worked in partnership with a number of different surgeons, from neurosurgery to general surgery to women's surgeons. And we came together to talk through what an algorithm looked like. How do we determine which patients should proceed with surgeries, which patients we should put on hold? Medicare published some guidance around how to sort of stage and prioritize surgery. We relied heavily on that document. And some of that was a day-by-day, hour-by-hour assessment and reassessment. We have been lucky to have never had not enough PPE, a shortage of PPE. So that was not a consideration for us. We also never had a shortage of ventilators or ICU beds.
Mimi, in addition to being one of the minds that helps run Tucson Medical Center, your background is in nursing. What is your prognosis for how Tucson Medical Center moves forward?
My prognosis is that we have been here for 75 years serving this community, and we will be here for another 75 years and beyond. We will weather this storm. We will weather it as we have in partnership with our community. As a nurse, I know that it will take some time for us to recover. You're starting to read some of the stories about the trauma that healthcare workers face. There's unquestionably been a lot of anxiety on those who are working on the front lines, trying to determine how to keep themselves safe, how to keep their families safe. And many of our physician partners are running their own businesses and their own practices and trying to figure out how to keep their own companies solvent and safe.
You raise an interesting point because as a business person and a healthcare worker, you've had to reconcile with some tough decisions during all this. What is your message to the public?
My message to the public is to seek healthcare services if you need it. I think we have too many patients at home with a lot of questions, and we're here. We're ready to provide answers if you need them. The emergency department is here. The thing that concerns me or keeps me up at night is the dramatic reductions in heart attacks and strokes that are presenting to the emergency department. And I worry that we have people who say, I don't want to get COVID, so I'm not going to go to the hospital, but that decision would result in something worse than COVID.
Okay, Mimi Kumler from Tucson Medical Center, thank you for your time.
Thank you very much. I appreciate it.
The pandemic presents varying challenges for Southern Arizona's diverse nonprofits. Some have lost hundreds of thousands of dollars, while others are seeing demand increase for their services. We visited a handful of groups to see how they're faring. Tony Paniagua and photojournalist John DeSoto have more.
They are bold, bright, and beautiful. But because of COVID-19, cultural attractions in Arizona are lacking the crowds that would normally enjoy them.
We were forewarned that something like that could happen here, and so we were thinking about it, but it quickly became an enormous, sharp reality.
Statewide, nonprofits find themselves in a dire situation. According to researchers at Arizona State University who surveyed more than 400 groups, 80% have reduced services, 20% won't have enough to pay staff in 2 months, and just over 10% are not operating at all. In Pima County, Tohono Chul is a 49-acre reserve dedicated to the Sonoran Desert region that celebrates art, nature, and culture. March and April are always financially significant ahead of the sweltering summer months.
What happened is that we were in the early spring. We were about to celebrate our 35th anniversary and one of the most successful and prosperous years in the history of Tohono Chul.
Shutting down in mid-March has been catastrophic, resulting in canceled events, no visitors, and the closure of a popular restaurant and gift store. Some staff are still showing up. Living plants require attention, while other employees work from home.
This situation is absolutely abnormal.
The Tucson Museum of Art has also had to postpone or cancel major events such as its annual gala. Like many other nonprofits, some staff have been furloughed, others have taken pay cuts, and part-timers lost their jobs. Jeremy Mikolazak moved here from Florida, where he ran another museum.
I can't imagine, I can't equate any time to sort of compare it to. Museums across the country have never seen anything like this. And like TMA, like most, I mean, we don't have deep reserves that keep us going, that could sustain us for, multiple years or say months on end.
One silver lining, he says, is that construction on a new wing for Latin American art has been able to continue. It had already secured enough funding from donors.
That's been sort of one of the sort of unexpected joys of during this really rough time period, I think, for all of us. But, we're looking at things like time tickets and things like that so that the public will be able to see the new wing and, of course, all the exhibitions that we have. It's been a challenging time. I mean, museums it's commonly sort of not understood that we plan many years out in advance.
I mean, one thing that
Lisa Hastrider-Lamb is the executive director and curator of the Mini Time Machine Museum of Miniatures in Tucson. She's also co-chair of the Southern Arizona Cultural Leadership Consortium, or the SACLC. It represents more than 30 organizations.
Even when we reopen, that we're still going to be impacted because so many of our organizations close during high season, and they rely on the revenue that they earn during high season to get them through the summer months when it's slow. They're not going to be able to open in the summer, even though the state's going to open up. They're going to have to wait till the fall, and some institutions might not be able to open up at all.
The consortium surveyed its member groups about the economic impacts of the coronavirus. It received 25 responses. Through the end of June, they estimate a loss of more than 800,000 in-person visitors. More than 1,500 events, programs, or courses will be canceled, and they will take a collective hit of nearly $15.5 million. Also, close to 300 full-time employees will be furloughed or laid off, more than half of their total workforce.
So it's quite devastating for our sector.
And while cultural nonprofits are seeing fewer people, the demand for those that provide social services is as strong as ever. For example, food banks are already seeing significant increases due to job losses and stay-at-home orders. In central Tucson, Emerge Center Against Domestic Abuse helps about 6,000 survivors and their children every year. It also works with hundreds of men who want to address their abusive behavior.
We have every reason to believe that the levels of domestic violence in our community are up. That because of the stressors that come with the economic impact of the virus, but also just the anxiety that people are feeling around the health risks as well. That kind of isolation from your support systems and that kind of all day, every day in the home with your abusive partner means that domestic violence survivors are actually at much greater risk now from that than they actually are from the virus in many instances.
Casa de los Niños has been in Tucson for nearly 50 years. Their well-known thrift store is currently closed, but their major mission continues. Casa offers abuse prevention programs to protect children, free parenting classes, and mental health services for kids and adults.
So what has changed most drastically is all of our staff is still employed, but they're working virtually. So they're having meetings with families through Zoom. They're having FaceTime with families. They're doing home visits virtually. So we're still, in fact, we're providing now to date as many services as we did prior to COVID. It's just a very different delivery system.
Unlike the cultural attractions we visited that rely mostly on public attendance and patrons for large portions of their revenues, safety net nonprofits say government funding and other sources have left them more financially secure during this pandemic compared to the other groups. But one thing they have all embraced is the use of technology to stay connected with their staff and the public. However, machines cannot replace people.
You know, it's tough. I mean, as a museum, to not have the public be able to enjoy your services or be able to engage is really, really challenging. So the monetary is part of it, but it's also the human factor.
That was Tony Paniagua reporting. We should note Arizona Public Media is a member of the Southern Arizona Cultural Leadership Consortium, whose chairperson you heard from in that story. Typically, this time of year, schools are preparing to break for summer. Instead, the coronavirus led them to empty campuses in March. This week, we asked educators how the extended time away from class challenges teachers and students. Before we get to those discussions, photojournalist Robert Lindbergh shows us how teachers from Lulu Walker Elementary in Tucson got behind the wheel and staged a car parade to reconnect with students.
There you go. Hold your side, Jax. To the camera.
We miss you! Hi, Miss Wicker. Hi, guys! Hi!
State education leaders are in the process of devising guidelines so schools can safely reopen in a few months. We recently discussed some of the impacts COVID-19 has already had on learning with Dr. Francesca Lopez, an Associate Dean in the College of Education at the University of Arizona.
it's a lot of uncertainty. I think we need to brace ourselves for a new way of learning, a new situation, a lived experience that many of us have never had before. Um, and then on the optimistic side, I know I've been talking with a lot of colleagues that there's also the advantage of children having been at home and probably, hopefully, having more time with their family, and what that could give them that they weren't able to get in the school day. So I think there's a lot of things that are still up to the imagination what it will need to look like. But there's definitely some of the things that we know we will have to deal with as far as making sure that we don't have another wave, which is something else that's being discussed.
Over the years, you've studied child psychology in a variety of settings, and granted, this is a pandemic none of us have witnessed before, but any early indications of how this might manifest itself when, ideally, we return to a fall semester?
You know, we've never lived through a pandemic, but I know we do have quite a bit of research out there on youth who have been in traumatic situations, right? Um, a lot of teachers have seen trauma manifest itself in their classrooms with their children. And the issue with children is they don't typically demonstrate anxiety, depression in ways that adults do. But we have the advantage of having research that can guide what do we do. We need school counselors. I know there's a huge limitation in the state in terms of ratios. We need school counselors, I think, more than ever to be able to help with the issues that our children are facing, to learn how to deal with them, to go into classrooms and have those discussions. Because without that coping, without the ability to heal from any kind of trauma, it's very difficult to have the opportunity to learn.
Zoom classes and car parades have all been ways for teachers to connect with the students and students to see their friends, obviously. Are there other things, though, that could be taking place right now to sort of help ease this transition?
If children have the ability to have access, I think being able to connect with friends is very, very important. And of course, that can become more difficult the younger the child is, but FaceTime and using other modes of communication is very important. Drawing on my own experience with my middle school daughter, she reconnected with friends that she hadn't seen in some time because they each went to different schools, and we're seeing her thrive in ways that the regular school day often didn't accommodate because the school day starts so early and there was exhaustion and everything is so structured. And so, with a little more relaxation in that structure, I've seen her actually have the time to have that connection. And I think to the extent that our already very taxed families and teachers are doing the very best that they can, if there is that bandwidth to be able to ensure that children are connecting with their peers or friends, I think that is very, very important because isolation is not good.
Anything about Arizona's school system that makes these students more likely or perhaps less likely to rebound after this hiatus?
I worry about the shortages that we were seeing in the teacher workforce before COVID-19, and what that will mean for students. Because a teacher who goes through professional training learns about child development. They are exposed to theories and research that becomes part of their toolkit so that when they are in the classroom, they're able to draw from those things to be able to be the best they can be for students. If we have yet another crisis with the teacher shortage, if teacher salaries, if we see education in pre-K through 12 gutted even more, I worry about what that will look like because inevitably it will affect our students. And so if we have a worsened situation for our educators, we're going to have a worsened situation for our students.
In southern Arizona, the Tucson Education Association is vocal in its advocacy for public school teachers. We asked Union President Margaret Cheney about some of the concerns educators have shared about the pandemic.
Part of the issue that I think is we might want to examine as a state is the fact that the last quarter of school has usually been spent with testing. And a large portion of time is devoted to preparing for the test, taking the test, testing. You know, that's at least 2 weeks of testing. So that leaves us with more or less 7 weeks, because you figure the last week is just the final assessments and graduation. So if that's the case, then how do we make up those 7 weeks? And how do we decide what is the most important work to be done?
Margaret, you said you've been in education for about 20 years now. Digital learning has not always been part of how teachers like yourself deliver curriculum. So what have been some of the greatest challenges and perhaps successes for you and your colleagues?
Some teachers have not had an issue with it, but other teachers are, they're strictly in person, having that one-on-one interaction with students. And so they've had a hill to climb. So the good news is now, instead of, well, gee, one day I'm going to learn how to create a website, or I'm going to learn how to use this software or platform, now they have to. And sometimes trial by error is the best trial. So you make mistakes, but it's not, everyone understands, and it's a learning curve.
This week, the district announced that there's a fair amount of students and families that teachers have not been able to reach. And for families who are sitting at home watching this may be startling. How is it possible that some families have sort of fallen off the communication radar in this process?
Not everyone has computers. Not everyone has the technology. Not everyone has the internet. We act as though, as a society, that everyone has access. This whole epidemic has shown, in a way, the need to provide more funding for public education. But I think that we really, as a society, really need to start looking at envisioning what future classrooms will look like. How do we schedule for next year? That's my first question, is how do we schedule for next year? Because the virus isn't going away. So how do you keep that social distancing going in overcrowded settings, in settings that don't have enough teachers, in settings that don't have enough resources, so now you have to share them? We need to really, really start thinking about that and planning accordingly how to address it.
That's all for now. Thanks for joining us. To get in touch, visit us on social media or send an email to Arizona360@azpm.org and let us know what you think. We'll see you next week.